We chose SpacePlus for a number of reasons. So we already have a Braun platform in the hospital, and I wanted a pump that would offer us newer technology than what we already have, and something that we could interface with from a technological point of view. It was simple to use, the staff liked it, it has everything incorporated that I would choose if I were designing it for myself.
I like SpacePlus because it is really easy to carry, and it is stackable as well, and it is handy for the patient to get the right infusion that they need.
When I came here, I'm using the same syringe pump and infusion pump, so it's very easy to handle the syringe pump because we can more focusing on the patient care rather than focusing on the IV fluid. Is it finished or not? We can adjust the rate, volume, and everything. And the screen on the syringe pump, for me, it's very effective for using and more focusing on the patient care.
Have lots of different options, so you can identify it's a good drug library, so you can say if it's a IV fluids, if it's electrolytes, if it's the infusion pump for noradrenaline. You can put the safety lock on it so family members and patients themselves won't use them. They're just all around better.
In using SpacePlus, especially here as a healthcare provider, it is a privilege to know that we have a reliable partner in giving a safe and efficient infusion therapy for our patients.
It's like a foolproof, you can safe-proof the fluids that you're putting on. You can make sure that you're putting the right dose, right volume, right drug. It kind of ties in with the 10 rights of drug safety checking.
It's very easy to arrange rate, volume, and everything, so it's going in its own. So no need to worry about, no need to spend more time with the infusion and syringe pump and everything. So we can focusing more on patient care.
This display on them is very clear, concise. It's quite easy for you to keep an eye on what medication is going in. You can look from it from outside the room. The different types of alarms, if there's an error in the line, it's finished, it's nearing its end. The colour coding, again, you can see what drugs are being used. The benefit would be the space, you can load them up together. There's you can put two pumps on top of each other. Yeah, just very beneficial.
So the transition from Space Pump to SpacePlus, it's not much of a difference since we are familiar with the brand, so you just need to follow the instruction given by the machines itself.
The transitioning between Space and SpacePlus was actually very easy. The instructions were all very similar, the actual giving sets were all the same, the prompts were quite familiar with everybody. It wasn't like you were changing a complete different pump, it was all quite similar. Minor little things that were different, but very few, so it was very easy. Everyone felt like they could, even if they hadn't attended the training, they could come on and they could figure it out quite quickly because it was so easy to use and so easy to transition from the old ones to the new ones.
The training is really easy to follow and straightforward.
So we opened a new ward here, so we actually had the rep in, so it was really beneficial. We got the whole group together, so we were able to go through interactive sessions, so everybody got to try. We actually got with little handy hints guides. Any issues, you can just go back, have a quick look at them. They have QR codes on them so you can look at the videos.
SpacePlus impacted my day-to-day life as a nurse since it gives us a great help to give the infusion that we need to our patient, and it's very convenient as well, and it gives us the patient a safe amount of infusion that they need.
It's very easy to manage the timings with the patient care, so just we need to start the pump and it will alarming us whether it is finished or not, because if it is a MDA high alert medication, the different color is like yellow and everything, so and the white screen, it's very visible to us. From outside the door itself we can see the name of the medication that's written on the screen, so it's very easy.
The impact of the new pumps have been great. It's allowed more time for the nurses to spend with the patients. They're able to provide better care because they can spend less time trying to calculate or different issues with the pumps. They're able to just have faith in the pump that they're working with, that it can tell if there's air in the line, if it's running out. You can plan your day and you can listen out for the alarm rather than wondering, is my pump going, is the fluids finished? It's just been very beneficial.
So the plan for future development moving forward will probably increase the amount of Brom pumps that we have, especially the space technology. It's small, it's interactive, and it's useful on the ward because we can stack them into a space station. We can pick it and go, because now they don't have an external power supply. So we can plug them in and keep them charged at all times.